evaluation and control, and what we need to do as organizations to ensure that we are able to evaluate our strategies in the right manner. So we have walked a journey when we began our discussions around strategy, strategy formulation, strategy implementation, what we just read recently. And now we cannot implement and fail to carry out evaluation. So it is important to be keen and understand how we can be able to go about the evaluation stage. So we are saying this is a very critical stage, and it is going to assist us to see how our strategies are performing, and also be able to see whether the strategies are aligned with our healthcare organization objectives, and also be able to see whether there are any adjustments that are needed. So strategy evaluation is very, very important. Through it, we can be able to see areas of correction. Remember, we do not have to evaluate at the final stage of implementation. Yeah, evaluation will take a number of times to do within an implementation of a strategy. That's why we are saying within it, we can be able to see whether what we are implementing is in line with our objectives. It's good to confirm. Once we realize some shortcomings, we can also be able to make adjustments and improvements, so that now the end result could be a better result. And also, when it comes to matters strategy control, we mean that we are overseeing and implementing, overseeing the implementation and execution of strategies. And the key purpose we are doing it, we want to make sure that we remain on course. And when you are remaining on course, it means and we are doing control, then we are doing everything possible to ensure that within our healthcare organizations and healthcare practices, we do not encounter anything that is going to enable us not to complete the implementation phase. So we are saying evaluation is one of the the final stage, and which is very, very important. And through these, managers can be able to understand the strategies that are underperforming. Remember, we could be implementing a number of things within our healthcare organizations. We could be seeking to improve the quality of care that we are giving to our patients. We could be seeking to provide education on various diseases so that people can be able to know them. And therefore, that's why we are saying once we are doing every other strategy that we intend, and we are doing evaluation, then we can be able to understand the underperforming strategies. And of course, once we understand the underperforming strategies, then we now be able to shape and come up with ways that we can improve on the underperforming ones. If it gets to the worst, sometimes we drop them because if it's a profit-oriented kind of an organization, then we do not want to put money where we are not going to be benefiting from those strategies. We are going ahead to say that, like I said, in terms of evaluation and control, it's a continuous process. So over and over again, we are going to be doing it. And some of the importances of strategy evaluation and control is, number one, it's going to ensure that the strategies are aligned with organizational goals. That's very important. That's why we need to continuously do it. And then after that, we are going to adapt to changing external factors. I think we did have a discussion around external factors. It could be factors around the political climate. Maybe we have changes in policy around healthcare. So when we are doing regular evaluation, then we are able to adapt to those changes. It could be changes around the legal environment. It could be changes around the economic environment, and so on and so forth. So regular or continuously undertaking strategy evaluation and control, then we are able to respond to any of these external issues that might arise. And finally, or last but not least, when we talk about strategy evaluation, it is going to help us drive ongoing improvement. It's going to help us ensure that we have continuous improvement of various activities. Now, the process of strategy evaluation and control will entail a number of things. Number one, we need to continually monitor results. And when we are monitoring results, for example, in the context of a healthcare organization, we could be interested in looking at various results around patient outcomes. This could be mortality rates. Maybe we had a strategy that intended to reduce the number of deaths within a healthcare sector, our healthcare organization. When you're also monitoring results, we could also be looking at the aspect of length of hospital stay. How long are, maybe we are thinking of an hospital, how long are patients staying within our facility? We could also look at readmission rates and many other things that could now be used as yardsticks to see whether we are achieving our strategies. We could also, when you are monitoring results, look at the clinical quality measures. For example, maybe we had a strategy in terms of improving our immunization rates. So we want to identify how or what steps we have taken to improve our immunization rates. Maybe within our facilities, hospitals, we have realized that we have so many patients that have blood pressure issues. So we want to check on blood pressure control rates and what we are doing around that. We could also have noted maybe around hospitals and other healthcare facilities that we have very many percentage of people that are having diabetes, for example. Then as we are monitoring results, after maybe we have implemented a diabetes management program and education, we could be looking at various indicators that are going to tell us whether the rates have stabilized or they have reduced. Maybe we have noted a huge increase in those particular rates. And when we are monitoring results, maybe finally around the financial aspect of any organization, definitely organizations that are profit oriented, they are looking for revenue and profitability results. So once we do monitoring of results in the process of strategy evaluation and control, the second one, we can compare to benchmarks and best practices. So we can compare with what other players within our industry are doing, how they are going about it. Number three, we are going to be evaluating efficacy and efficiency. And this is going to involve that us ensuring that we have the delivery of healthcare being very, very effective around us. When we are evaluating efficacy, we could be, for example, look at various clinical outcomes and ask ourselves, are we achieving the desired results? We could also look at, if we are dealing with the patients, we could look at patient-centered care, and the key purpose is to evaluate how well healthcare providers are meeting specific needs. So, or how organizations like any other healthcare organization is meeting various patient-centered care activities. And then on the fourth process, we now do what we call controlling of variances. Variances could be what we call differences in care delivery. It could be shortcomings within the evaluation process. And when you are doing that, it's now going to put us in a place where, for us to be able to minimize the variances that maybe we could have noted, then we could implement standardized procedures for undertaking a particular activity. maybe we have noted variances in terms of our healthcare staff or our organization staff not very being conversant with what is happening around them. Maybe in terms of service delivery, they are not doing it as we would want them to do it. So we could realize that's a variance. So part of providing a solution, we could provide training and education to these healthcare staff. Now, when we are evaluating strategies, we are saying that we need to trigger questioning. It is about asking questions around the strategies, and also it is also going to involve reviewing of objectives and creative problem solving. So we could identify problems around the healthcare organization. Then we could propose different ways on how we can be able to solve those problems. And this is going to be very critical because we also want to onboard and bring all the management and everybody within the healthcare organization. We want to bring them on board so that they can play a critical role in terms of evaluation. And when we are measuring organizational performance, it is important that we check our expected results and compare them with our actual results. Remember, anytime we are doing any performance evaluation, we have to look at our current situation. Where are we at? And the actual results, or where do we want to be? Then through that, we can be able to check various deviations, if any. We can also do evaluation at an individual level performance. Remember, when we look at an individual level, then that is going to take us to the level of an organizational level. So it is going to be very, very critical to be able to understand that. And when we are also doing organization or measuring organizational performance, we're also looking at both long-term and annual objectives. They are commonly used to be able to measure performance. Now, we had just mentioned a point on evaluating efficacy and efficiency. And this is also going to involve assessing how well the strategy achieves its goals. And that's what we call efficacy. And also, in terms of efficiency, we are going to be looking at optimal resource utilization. When we use the word optimal, we mean maximum. So we are going to be looking at how maximally are we utilizing the resources that we have. And if we are doing it right, then we are going to experience efficiency in all our activities. So resources, I have repeatedly mentioned and said we are talking about human resources. We are talking about the financial resources. Now, what is the importance that you are going to realize when we are doing evaluation of efficacy and efficiency? Number one, we will be able to maximize the impact of strategies. So we will be on the route of ensuring that we fully take advantage of the benefits of the strategies that we are implementing and evaluating. And also, we are going to avoid resource wastage. Remember, when we are looking at optimal resource utilization, then we are also ensuring that there is no resource that is going to waste. So financial resources, we ensure maximum utilization of them. Human resources, time, and so on and so forth. Now, we have what we call key financial ratios for strategy evaluation. When we are doing strategy evaluation on the aspects of finances, or the financial position of the healthcare organization, we look at a number of things. We look at what we call a return on investment. We look at what we call debt to equity. We also look at profit margin. We also look at return on equity. We also look at or conduct evaluations around earnings per share, and also we also conduct evaluations around sales growth. And these are discussions that we are going to be having in our next few slides. So when we talk about return on investment, we are simply looking at evaluating the profitability and the efficiency of an organization. And when we are looking at return on investment, then we are simply asking ourselves, if we spend this amount of money to set up this organization, is it, or are we going to realize a return of that money that we put up into the organization? Yeah. So that's why we are saying in this particular sentence here that what we are calling return on investment is going to help us assess whether resources allocated to a specific strategy or project are yielding a favorable return. Nobody, of course, wants to be in business where there is no return on investment. And so this particular ratio, this particular criteria of measuring the financial aspect of the organization is very important to tell us whether we are receiving our returns, or whether we are able to get what we put into the organization. Then we have what we call debt to equity. And when we talk about debt to equity, it's simply a measurement that seeks to compare a company's total debt. And of course, we are comparing the long-term and short-term debt. And the purpose is to understand whether we are able to meet the obligations that come with this particular debt. And we are also saying, when we are monitoring the debt to equity ratio, it is very crucial to understand that it comes with financial risks and the stability of the organization. And when we have high ratios, then it means we have excessive debt. I'm sure you have had countries that are also having excessive debt, and this becomes difficult for them to be able to operate, because now it simply means they cannot be able to borrow more. And then we could also use what we call profit margin. And in profit margin, we are seeking to measure a company's profitability. And this we express the profitability in terms of the percentage of sales. So the key word in terms of profit margin is the aspect of profitability. And it is very important for all healthcare organizations to access that. And it is going to assist every organization measure its financial performance of any strategy, or maybe we have a new product in the market. We could also be able to measure how the product is faring on. We have also what we call return on equity. And we are saying this particular ratio is going to assess the profitability of a company in relation to shareholders' equity. So when we talk about equity, it's all about the value of shareholders' equity. A share, what we talk about when we talk about a share, it simply means a unit of ownership. So when we use the return on equity ratio, it is simply going to reveal how well a company it's utilizing its equity. How well is the company, in simple terms, utilizing the money that shareholders have been able to put in, maybe into the healthcare organization, in order to be able to generate profit. And we are saying it is a very, very essential ratio that will assist organizations measure effectiveness of strategies in creating value for shareholders. Of course, no shareholder wants to be in a position where they are not getting returns for their money. And therefore, this is a very, very important ratio to ensure that we are continuously evaluating and checking whether we are able to achieve it. And then we also have what we call earnings per share. And we are saying this is a metric that is important in terms of calculating the positions of a company's profits that are attributed to each outstanding share of common stock. And when you talk about earnings per share, it is simply us looking at the monetary value of the earnings per outstanding share of common stock in a company. And this is very, very important in healthcare organizations also. It could also be a very important ratio that is going to help us understand our financial performance in terms of share basis. I'm sure you have heard about the trading of shares. A share is deemed to be very well if it's performing well in the stock market, and therefore earnings per share is meant to find out how is each share within our organization, our healthcare organization, how is it performing in terms of even the numbers of people that are requesting to buy that share. In terms of the price per share, is it increasing or decreasing? All those are things that we can be able to note around the stock market discussions. And finally, on these ratios, we have what we call the sales growth. And this one is meant to measure the percentage increase in companies' revenue over a specified period of mostly a year. So through the sales growth ratio, we can be able to tell whether there is growth or there is decline in sales. Of course, remember where we have positive sales growth, it indicates that maybe some strategies that we put in place are working positively. If we realize, for example, the numbers that I was talking about in terms of blood pressure control rates have reduced, that could be a reason for us to understand that this particular strategy that we put in place is working. But ideally, the sales growth ratio will mostly be used in organizations that are profit oriented. So they will be looking at the strategies that they put in place in conjunction with the level of the growth of shares. Then they can be able to say it's a positive increase in sales or it's a decrease in sales. And when there is a decrease, of course, it may mean that the strategy that we put in place, maybe to reach more customers, may not be working. We have what we call effective evaluation systems characteristics, and we are saying effective strategy evaluation must be economical. So how much are we spending to carry out the evaluation? We could have maybe invited external evaluators who are quite expensive to carry out the activity. And the evaluation also should be meaningful, and it should take us to a place where we are receiving timely information where possible. And also it should offer managers control and influence over relevant tasks. And we also need to avoid the aspects of having too much information and excessive controls. When we are doing evaluation, we just want to see results. You could send me to give you some results on some evaluation. Then I give too much information that some may not really be necessary. So we are focusing on results, maybe on the achievement of a strategy, and therefore we need to keep our information simple, evaluation information very simple, that everybody within the organization can be able to understand what we are doing in terms of conducting evaluation. we have something we call fair strategy evaluation, and we are saying any evaluation, for it to be deemed to be fair, it needs to provide a true picture of what is happening. Yeah? And it is also going to consider situations like economic downturn. Sometimes we could have overall challenges around the economy. I'm sure during the period for COVID-19, we must have had so many companies that had to re-strategize. And when you re-strategize, you are coming up with new ways of doing things to see whether they are going to work. So when it comes to recovery, then a fair evaluation strategy would involve you giving us a true picture of what is happening. And we are saying this should be designed to trigger action that is directed to those who need to act. So anybody along the strategy that needs to be involved needs to be invited to take part in the evaluation and ensure that this particular information that they are giving us is factual and is fair. It's the real information, even if we are looking at the aspect of how the economy is working. Now, when it comes to success in strategy evaluation, we are saying that we need to consider having mutual understanding, trust, and common sense within all the players, the evaluators, the employees within the healthcare organization, the management. And that's where now that takes us to understanding that the cooperation among departments in evaluating strategies is very crucial. So that is simply to tell you that for a strategy evaluation to be successful, then all the players within the organization must be involved and they must take part in understanding this strategy and playing a very crucial role in terms of evaluation. And we are saying once we are doing this evaluation, the process should be very simple for everyone to understand and do not be very cumbersome in terms of the execution and the evaluation activities. So that is going to help every organization to understand what is going to happen in terms of the evaluation. We have also the aspect of contingency. We had this discussion in one of the lectures, and of course we need to have a contingency plan, and we need to have a way we can have alternatives. Remember, we have said evaluation is continuous, so midway we could realize something is not working right, and once we realize that, then we could switch to other alternatives to be able now to proceed. And that's one of the major reasons of continuously doing evaluation, so that you can always see whether you are on track. We could also adopt various multiple controls within the organization setup. For example, we could have controls around what we call feed forward. This is where we are able to receive various informations in advance. And these ones is going to help us anticipate in terms of preparing for the future. So an example of how to undergo or to use feed forward is when we do preventive healthcare, when we conduct education on lifestyle choices, when we do early detection and screening of various diseases. All that is what we call feed forward. It means when we are doing early detection, it means we are receiving information in advance that is going to assist us to make some corrective actions. So when we adopt these multiple control systems, they are going to help us define performance standards, and they are going to help assist us in terms of feedback in terms of achieving our strategies. Now, we have challenges that are brought about by various control systems that we could adopt in organizations. And one of the major issues is consensus on the criteria. That simply means we could be having a challenge on agreeing on what criteria to use to exercise various levels of controls. We could maybe want to do a controlling activity around the human resources. I saw another organization that was emphasizing that everybody, once they come in the morning, they need to uh, clock, they need to use their fingerprint on the clocking system. Remember, that can be printed anytime and show whether you have been absent or not within the workplaces. So maybe not all people are going to agree in terms of that controlling style. So that's the issue about consensus. Sometimes we want to take some control measures and individuals are against it. We could also be having invalid data. Maybe we have not gone to the field. Maybe we want some data, patient related data, and we have not gone to the field. Or we have gone to the field and have not collected data as it should be. So it means we could be using information that is very invalid. And other problems could be organizations emphasizing on long-term performance or short-term performance and forget the longer term ones. And also there is a challenge or the problem in terms of setting performance levels. And so we could also have many other problems that will arise in terms of control systems. Control systems are simply the measures that organizations are putting in place so that they can control a number of issues, just like the example I've given in regards to human resources. So you could identify within healthcare organizations and see the control systems that are in place, and then see whether they are working for the company or against the company. Now, when it comes to aspects of monitoring, we are saying it's an ongoing process that is going to to track the progress and outcomes of your strategies. And through monitoring also, we could provide real-time data for decision making. One of the most important issues for monitoring or significance is through monitoring we could have what we call early detection of various issues. And once we do early detection of various issues, monitoring also assists us to ensure that the strategies that we have are on track. And therefore, on the third significance, it's going now to ensure that the decisions that we are making are data driven. Remember, when you are doing monitoring in a healthcare organization, for example, you are looking at what is happening at every step along the way. Yeah, so all the decisions that you make, they are not just decisions from the moon. They are based on certain data that you have collected when you are doing your monitoring activities. Now, when you are doing monitoring, we could do that through regular data collection. That's actually very, very important for any healthcare organization. We want maybe to introduce various vaccinations. We want to introduce various policies. Then we cannot just do that as a by the way thing. So we need data guiding us. We need analysis and interpretation. So that analysis and interpretation we are doing for the data that we have collected. So we need to practically see whether the information that we are receiving from various sources is correct. And we can interpret it now and narrow down maybe to a certain solution. And then we can also do reporting and communication. And finally, we have the issues of controlling for variances. I did say variances are differences and shortcomings that we could be noticing when we are doing monitoring and evaluation. So that involves us detecting and managing these deviations. So we can always detect when these variations and shortcomings are taking place. And once we detect these variances, the key strategy or the key goal is to ensure that everything stays on course. So we cannot, there's no time we will be doing monitoring and evaluation and realizing that everything is 100% okay. Uh, we will have variances all the time. So what is the importance of controlling variances? What is the importance of controlling those deviations? The first one, we are going to be able to maintain and align our objectives with the strategies that we have set. And also, secondly, we will be able to preserve resource efficiency. So if we note deviations around human resources, maybe along the way we could say we are overstaffed. So it means there is a challenge. Maybe we are spending a lot of money within our healthcare organization system. And therefore, a solution might come even along the way in terms of implementing the strategy to simply say now we need to do organization restructuring. It's not a must we send employees away. Maybe we could be having departments that are understaffed. So we could do redeployments within the organization, and we could do uh, also we could assign people more responsibilities so that we can be able to maximally, remember we talked about optimum utilization of resources. So when we do that, we will be able to optimally utilize our resources. So I invite you to do research around strategy evaluation, get to know also practically what healthcare organizations are doing in terms of the strategies that they set, and the evaluations. What is it that they are doing in terms of evaluating and controlling all the activities? So that is going to bring us to the end of our discussion. Unless there is any comment, maybe I would wish you a good night.